Hey, thank you everybody for coming. John, I will let you take the reins.
Okay, at least verbally, not technically.
No, not technically. I got
Yeah,
that.
yeah, there you go. All right, welcome everybody. I'm John Lodice, and I am the vice chair of the HLC board. So I will be kind of your docent through the agenda this morning or this afternoon. This meeting is because it's in October, this meeting is going to focus on the membership drive, or no, it's November. Well, that's two timing I got wrong right off the bat. So here we are in November. This is going to be the last meeting of the calendar year. We're not going to meet in December. We will meet in January, whatever the date of the first Tuesday is in January. And um, at that time, we will be very much absorbed in preparing for PIT, and we'll also be in the midst of winter. So that is probably, after we talk about membership drive, we're going to talk a little bit about winter in this meeting, really briefly about what some of the main topics are, so people can anticipate what we're going to be dealing with as we get into January for our next meeting. So anyhow, this time of year is when we basically try to encourage people to become members. And there are, Rosie's prepared a really good PowerPoint slide here. You can visit our website. It will give you the directions on becoming a member. We do have dues. The dues do help to finance certain administrative costs that we incur in kind of in operating the business of the board. Um, so what does it mean to become a member? And there's a lot of different points here that are important. So it's a great way to get connected. It's a great way to learn about issues and to figure out how you might need to advocate on issues that affect your connection to work as a homeless service provider or on your other work that may connect to the issue of homelessness. It's an opportunity, as it says here, to create partnerships, to learn about what are considered to be best practices. This is especially true in data reporting, which is becoming more and more of an important topic as data reporting becomes more and more central to how people get funding and keep funding. It is a way to get connected to the best way to access different resources. That could include funding, that could include volunteers, that can include partnerships with agencies that connect very well to your work and can support your work. And it also can include training, which again is also becoming an issue more and more central to how service providers are funded and how your people are prepared in the best way possible to do the work that they do. It is also a way to be in the community and to understand who else is doing this work, who else are doing things that connect in some important and tangible way to your work. And it's a great way just to be informed about that. Also, you can stay in the loop, and it says here updates on regional and local initiatives. So right now in the news, there are a lot of different things going on in terms of regulation. We have the issue with food benefits. We have the issue with funding in general. We are learning different ways that the shutdown of the federal government is affecting people's services. For example, people are visiting the Social Security office and they're finding out that the services there are either limited or not available and can only be accessed online. So all of the things I've talked about so far, you might say, I can do all those things even if I'm not a member. And honestly, that is all true. I kind of compare it to joining a gym. So when you join a gym, I think two things happen. You're kind of making an open expression of commitment, saying, I really want to get in shape. So when you become a member of the HLC, you're saying, I really want to be involved in this work. I'm going to step forward and make it known about my intent to be involved and my commitment to stay involved. Also, I found out the one time I joined the gym a while back, I ended up going to the gym 5 or 6 times a week. And I know I was only doing that because I had made that formal step of joining a gym. So it really can work that way. When you step forward and become a member in a formal way, you suddenly find yourself connected in a deeper way, connected in a way that's letting others know, yes, I really am going to be a part of this community of service providers and other people who are concerned about the issue of homelessness. So that's my pitch. Now, there are a couple of things that you do as general members that you can't do if you're not a general member. The first is you can vote for board members. So we hold elections when we need to fill seats in the board. And right now, we're not in that. Rosie, where are we at in terms of the need to fill seats?
So we only fill seats outside of our general election time period, which is December, January, when we fall below quorum, which currently we have quorum, so we are good on that. We have a seat to fill for that it's reserved for Warm Springs, and then for an individual from the Warm Springs tribe. And then we will have, at this time, we have one empty seat to fill in December. And then we will, if there's, I want to say 5 board members who will be up for either reelection, or if they're choosing to step down, their seats might be needed to be filled.
Okay. Well, when those events happen and those seats open up and they need to be filled, we bring candidates for the open seats to the general membership, and we have the general membership, we arrange for the general membership to vote on them. So it's an important way to affect how the business of the HLC is done. The one thing I'll say about the board, just to be clear, it's a governance board. It is not a service provider board. As a shelter provider, I kind of had to make that personal adjustment. I was used to being oriented toward direct service of our guests and the folks in our population. That's not exactly the work we do. We tend to make sure that all of the formal requirements of having a continuum of care in our region are met so that we can continue to be eligible for funding and that we can continue to be connected to the overall support system for homeless services in the way that we need to be. And so we're making higher level administrative decisions. We are reviewing certain funding streams. We are creating and responding to and reviewing applications for funding that affect us on a regional basis. And that's the basic work of the board, the governance board. And so, as I said before, if you're a general membership, you have the opportunity to vote for the people who are doing all of those things. As a governance board, we have to follow a charter. We just can't make up everything as we go along, thank goodness. So we have a written charter that talks about how the board can make decisions, how the board can keep itself fully, keep all of its seats filled, how we do all of those things, what are our priorities, and how we make governance decisions. For example, regional diversity, making sure that the membership of the board and the business of the board doesn't tilt too much in the direction of one type of interest within the continuum. So, and the charter guides us on all of that. The charter is very much a living document. It's not something that somebody created a while ago that's set in stone. We're always looking at ways to change the charter so that it can help us do our governance work in a way that is responsive to the ever-changing landscape of homelessness in our region. And so as we're working on these changes, and that's something that we're going to make a focus of 2026, is we want to take a hard look at the charter and decide how do we need to change this document so that it better guides us in all the ways we need to respond to the fluid situation of homelessness. We'll be making and working on changes, and we'll be asking the membership to vote to either approve or disapprove those changes. And that will be another important function of our membership as we go along. And the last box here says make an impact, collaborative impact model, all voices heard, create change. And again, if we can create a stable and well-connected community of people who are interested in the work of the continuum, then we're going to make more of an impact. And I think people committing to membership uh, and making it a consistent, making that a consistent part of the way they approach their work, I think that will just make a stronger impact on what we need to do as a region. Regional strength, I think, as we look at the current issues, is becoming more and more important because a lot of funding decisions are made on a regional basis. State and federal government agencies look at Central Oregon as a region and say, what does that region need? Is that region effectively carrying out its work, et cetera? The stronger is that region reporting data in an effective way that's making it easier to see why funding decisions are justified. All of those things are important. And so the stronger and more unified we are as a region in responding to all of those challenges, the more likely we're going to be highly regarded and receive the funding that we need to do the work the way we think it ought to be made. So there, I think that's the best pitch I can make for why you should care about becoming a member. So maybe we can go on to the next slide now.
This is just some of
Oh,
our,
yeah, actually, okay. And then I want to make sure we leave room for questions too before
yeah.
we go off of membership. Yeah.
Yeah, I just wanted to say these are just some of our, I was throwing these in here today, so some of these are new and renewing members. And I did have a couple come through right before we came on. I didn't have time to get them on, but we will be celebrating those renewals as well. So just wanted to say thank you to our members and the continued to support, and hopefully we will continue to support you all as well. We could probably see if there are any questions at this point before we move on to our presentations. See any hands? Am I missing any? Okay.
Okay. Yeah, we do want to just run through the preparing for winter slide. I think that's
Yeah.
important just to focus people on those issues.
Yep.
So cold weather and the Central Oregon winter has always been one of the central topics, issues, challenges of doing this work, doing homeless services in Central Oregon. It tends to be what mobilizes a lot of support for homeless services and brings a lot of attention to the issue of how we care for our population. So the newsletter will, to the extent things happen in terms of both events that result because of cold weather or maybe views that are expressed about homeless services during cold weather, our newsletter will include those types of things. A very important event that we hold every December 21st, which is the winter solstice, is the longest night vigil. And that is a memorial for all of the folks we have been serving who frankly just didn't make it through the year. And we hold a memorial to honor them. Then we'll have the point in time count in January. And this year it is going to be on the last Monday in January, I believe, is the date that has been selected. And that, if for anyone who doesn't know what the point in time count is, it is a HUD mandated survey of our population, and it is basically trying to find out everyone who was homeless on the night of the selected point in time date, and then trying to get as much information as we can in a short survey about their situation so that more intelligent funding decisions can be made. And to the extent that there needs to be advocacy to fill needs, we look to the pit count to be able to support that as best it can in an objective way. Then we will be preparing, we have preparedness meetings. In fact, we have one coming up on November 11th that I think will involve a lot of service providers, and that Marissa is going to talk about that in a very short while. We have Thanksgiving dinners coming up. And I think those are held on different dates. They tend to be either on the Wednesday before Thanksgiving and maybe on Thanksgiving itself, though hopefully we can hear more about that in this meeting. And then finally, we may learn about other holiday resources, and we're going to ask service providers toward the end of this meeting to give any updates on particular holiday resources that they might be offering, either for Thanksgiving or for Christmas time. So
And I would just like to plug that if you know about a community that is doing a longest night vigil, or if there's Thanksgiving dinners that you know are open to the public or for our homeless neighbors, to please send that information my way. You can either do it at just the info@cohomeless or my email rlori@coic.org, and that way I can get those into the newsletter. And we would even like, I think that if I got a lot of information around Thanksgiving stuff, I would send out a special mailing to service providers with that list so that it's all in one place. So more than happy to get those on our website as well. So if you all know about any of those things that are going on, or if there's more longest night vigils that we're unaware of that that are happening in your community, please do send those along to us so that we can make sure to attend with you, and then also get those out to the service providers.
Okay. So yeah, I guess we are ready for our first presentation. That is going to be Marissa Korobkin, who works for Deschutes County Health Services, specifically the emergency preparedness program. And so Marissa, go ahead, take it away.
I'm gonna stop sharing so that you can now share.
Okay. Yeah. Thank you, Rosie. Thank you, John. And then really quickly, while I am getting set up sharing my screen, I did just want to touch base. So the meeting on the 11th, I think that's being hosted by 211. County buildings are actually closed that day. So unfortunately, we will not be able to participate in that. But regardless, other meetings, myself and Carissa love to join meetings to be able to share about cold weather preparedness. So, sharing on this meeting, sharing on the shelter meeting, the street outreach meeting, anything that we are invited to, we're always happy to come and just be able to share the information and the resources that we have. So 1 second here. All right. So many screens, just wanting to get everything going. Okay. Does everything look good on your guys' end?
Yep.
Okay, perfect. All right. So yes, I am with Deschutes County Public Health Emergency Preparedness. I'm a project manager, so I work closely with Carissa Heineke, focusing on our extreme weather operations for summer and winter, and then I do a few other things on the side. You may have seen me also communicate about things regarding Juniper Ridge, and then I also do our public health communications as well. So lots of different things. But I'm here today to talk about winter weather preparedness. I know that all of you are very familiar with this, either working in a shelter setting or in an outreach setting. So I know that this is probably a lot of refresher for you, but just wanting to provide this information as a refresher, as you're supporting clients, as you're also supporting yourself if you're out in the field at all, just being mindful of cold weather related illnesses, also wanting to just talk about heating source safety, respiratory illness overview. It is respiratory season. And then I'll also be sharing our locations of our extreme weather sites across Deschutes County, the resources that our team has available for you all, and then any questions that come up. So really quickly, just wanting to talk about cold related illness and hypothermia. These are kind of our bigger things that we think about when going into the winter weather season. There are definitely some other things, like trench foot is another big one, but I'm just going to focus on frostbite and hypothermia today as kind of the major ones we're always thinking about. So frostbite usually is one that affects the skin. It's often presenting as bright red skin that can be painful to the touch. And it can also include and progress to numbness, blistering and burning of the skin. The skin sometimes will be a yellowish or a grayish texture, and it can also be very firm. So when thinking about frostbite, ways to treat that would be if the person is wearing any sort of wet clothing, that's top priority, wanting to switch that clothing from wet clothing to dry clothing, and then using any sort of pain reliever as needed. It's definitely important to not have that person rub the affected area, as it can make the skin condition worse. And then also, if the frostbite is on their feet or their toes at all, really wanting to avoid walking unless absolutely necessary, just to not exacerbate any issues. Ways that you can help alleviate some of those symptoms, even though medical attention is definitely recommended, is using warm water to warm up the areas, but definitely important to make sure that it's not hot water. Again, that can make the situation worse, and then also not wanting to use any sort of direct heat, either from open flames or a heater. Just really wanting to use lukewarm water to be able to reheat that area. For hypothermia, that one actually affects usually the brain a little bit more than physical symptoms. It can happen usually when it's really cold out, but again, even if, if someone's not wearing proper clothing or they're wet at all, it really can happen at moderately cold temperatures as well. So those symptoms usually start with a physical symptom, so a lot of shivering, stiff muscles, or fumbling hands. And then it can also experience cognitive symptoms such as confusion or slurred speech. Memory loss or sleepiness are also some other potential symptoms as well. And so if someone potentially has hypothermia, being able to, again, replace those wet clothes with dry clothes, really focusing on warming up those body's core areas. So the chest, the neck, the groin, and the head are those core areas that you want to try to warm up, and then drinking any sort of warm liquids as soon as they're able to. But for both of these, people should be seeking medical attention as soon as possible if they're experiencing any sort of severe symptoms, if their body temperature is 95 degrees or below. And then also with frostbite, if they're losing any feeling, if their skin is turning black or their muscles or joints stop working. And then if somebody is uncontrollably shivering, you also want to make sure that you call 911 for them. So with our hypothermia and frostbite, really, I think the best form of prevention is wearing proper clothing. So really the focus is being able to dress in layers, making sure those layers are easily removable, and then also making sure that you're not wearing too many layers, because that then could lead to sweating, which could inadvertently lead to hypothermia. So it's really kind of finding that right balance of layers. And then also focusing on the material. Again, I know that this is a hard challenge, I think, too, especially, people are wearing what they have, but really fleece or wool clothing is a better option for winter weather. Cotton clothing, it can absorb moisture and it just doesn't insulate as well. So it could, again, make that person colder. Also wearing an outer layer of water-resistant clothing just to have that person be able to keep dry. Some other potential things that you could do as well for insulation, so laying blankets or cardboard under or inside a tent can help, again, have that person not be directing with cold ground. And then just thinking about Central Oregon, in the winter and in the summer too, it's definitely pretty windy and can get pretty windy during a storm. So again, just keeping that in mind and trying really hard to stay out of the wind if possible. That just is a better method to be able to try to stay warm and dry. And one other potential method as well is the use of hand sanitizers. So those, again, could be really helpful for warming those core body areas. But just one important thing to know is definitely not using those hand warmers to fall asleep with them or to be placing them directly on the skin, as that could potentially cause skin burn. And then just another thing to note is that alcohol and drugs can lower just body temperature awareness. So that, again, is something that could increase the risk of hypothermia. And then just wanting to touch really quickly on pet safety. I know pets are a very important member of the community. So just wanting to make sure, you know, as people are dressing themselves, wanting to think about their pets as well. So again, trying to have a coat or a sweater to be able to put on that pet. Also being able to protect their paws. And so that would be, you know, wiping their feet pretty frequently, removing any sort of snow buildup or ice buildup or any sort of de-icer that might get on their paws. And pets can also experience hypothermia. So being aware of the signs and symptoms of that and knowing how to treat that. So they might be whining or shivering. They may also be anxious or moving slower than usual or not moving. So if that is something that is identified in those pets, trying to get them to a warmer place, being able to use blankets or towels for heat, and then seeking veterinary care as well. And really quickly, our heating source safety. So public health preparedness does not recommend wood burning fires, just knowing that, you know, even in winter, there is still a pretty large fire risk. And so we try to recommend an alternative. So using fuel burning heaters with propane, and then also just making sure that those are on a sturdy surface that is not flammable, just to prevent any sort of issues. Using that 3-foot rule, so a 3-foot buffer zone around a heating source just to avoid anything potentially catching on fire at all. So that would be, you know, 3 feet away from any sort of sleeping bags or clothing, tarps, really anything that has the ability to catch on fire. And then also making sure by not leaving those heating sources unattended or on while sleeping. I know that that is definitely really tricky to, you know, turn off a heating source before you go to bed and wake up in the middle of the night freezing cold, but it's really just a safety perspective that we really try to promote. And then also not spraying any sort of substances or smoking near those heating sources. If that person is using a generator, we want to make sure that that generator is outside and the exhausts are pointed away from their RV or their tent, really to try to limit any sort of chance of carbon monoxide poisoning. And really just always wanting to promote good airflow, good ventilation to reduce that risk of carbon monoxide poisoning. And with carbon monoxide poisoning, that's definitely a major concern that we have for the winter. So that occurs when there's a buildup of carbon monoxide, if those fuel sources are used in an enclosed space or there's just not a lot of good ventilation. It's really tricky. Carbon monoxide is a silent killer, so it can't be seen, it can't be smelled or heard. So being able to know those warning signs and symptoms is really important to be able to seek care as needed. But if there is any, I mean, I would recommend if that person, if there's anything that is smelled that's unusual or any sort of smell leaking from a propane tank, from a heating source, just shutting that off and getting into fresh air immediately. It's always better to just turn it off and kind of reassess and figure it out than leave it going. The signs and symptoms of carbon monoxide poisoning are a dull headache, vomiting and nausea, blurred vision, confusion, loss of consciousness, and shortness of breath. And so if someone is experiencing any of those symptoms, we would just strongly recommend, you know, shutting off that heating source, getting that person into fresh air immediately, not re-entering that area, and calling 911 for medical care. Just touching really quickly on respiratory illness. It is respiratory illness season as of October. So lots of stuff probably going to start coming around. So really we think about flu, RSV, and COVID. With those, we definitely promote vaccines to reduce the severity of those illnesses. So flu vaccines, COVID vaccines, and then RSV vaccines if someone is eligible to receive those. But in combination with vaccines, there's always a lot of preventative measures that people can take as well. So, you know, washing your hands, using hand sanitizer, wearing a mask when you're sick, just to try to reduce the spread of any sort of illnesses going around. And then I would recommend for any of our partners on the line that are congregate settings in Deschutes County, I have our public health communicable disease phone number listed here. So if you have any questions regarding infectious disease, regarding outbreak protocols or anything like that, always feel free to contact them. And then really quickly touching on our resources available. So these are the resources that our public health emergency preparedness team has. So we have our extreme weather email communications. You'll see those a lot from us in the summer and the winter, hopefully not too much, but we try to communicate out anytime there's any sort of inclement weather that we want people to be aware of, any sort of changes to operations because of that weather, and any sort of resources that we have to share. So that's an email listserv for us. We have our waterproof booklets available and ready to go again for this winter. So those are little pocket books that have cold-related illness signs and symptoms, ways to stay warm, and then also locations for our warming shelter sites. So those are also something that I'm happy to hand out to everyone. We also have our location flyers, and then we have our website. So deschutes.org/shelter and 211 info are great resources online to be able to check out any of those locations. And then if we do get to a point where, it's really, really cold out, a whole bunch of snow, we do have activation thresholds that we have identified. And so once we hit those thresholds, we'll work with our identified warming shelter partners regarding surge operations and any sort of ability to potentially expand. And then if you are interested in those booklets and that email list, I will drop that information in the chat to be able to sign up for those as well. And then lastly, for our warming shelter sites, these are sites that we usually have a pretty fixed schedule on almost every day of every season, but just wanting to kind of highlight those again for everyone. So in Bend, we have Lighthouse, Council on Aging, and the Downtown Library. One change this winter season is that the East Bend Library is closing on November 15th, so they will not be available as a warming shelter site. And the Central Library, when that is ready to open, that may be available, but I don't think that's going to be until summer. For Redmond, we have Shepherd's House in Redmond, also the Redmond Library. Lapine, we have Lapine Library, Lapine Activity Center, St. Vincent de Paul Lapine, and then the Door Church will be opening for their overnight operations starting on December 1st. So they'll be December 1st, I think, through the end of March. And then if needed, they could open sooner, but scheduled for December 1st. And then Sisters, we have the Sisters Library, Sisters Park and Rec. And then we also have Sisters Core, formerly Sisters Cold Weather Shelter, that can open for emergency overnight operations as long as we hit a specific threshold. So that one is one where, if we hit a threshold and need to open, we'll communicate out that they are open. And then any sort of changes to these operations, we know it's winter, sometimes places need to close early because of inclement weather and travel. We'll update that information on our website. So our website is definitely the best place to go for us to be able to get that timely information. And with that, I just wanted to say thank you. I have my contact information here. I have Chris's contact information as well. We're both available at any time for any questions. But if there's any questions right now, I'm happy to answer.
We did get a question in the chat from Sandy Schmidt asking if you had any specific brand of heaters that you would recommend.
I can get back to you on that. There are some potential. I know buddy heaters are a common one that people talk about, but we just try to be very mindful of promoting any sort of one brand. But I'll definitely take a look and see with our health services director if there's one that we can share, and I will share that information out as soon as I have it.
Anybody else have any other questions?
So not a question. This is Linda Long, and I spent 3 years on Mount Bachelor in China Hat, and so I really appreciate those guidelines, but I just want to mention that they're basically nearly if not absolutely impossible to actually implement. I, for example, lived in 420 square feet in a 1966 camper and trailer. There were nowhere there was not 3 feet between me and a heater, like, ever. So
Yeah.
I'm just saying, if we're those, I just want to say I love the guidelines and I think they're absolutely necessary, but making them doable is the whole other side of that coin. I just wanted to say that, and I'm not camera ready today, so I'm not turning on my video. I am not camera ready at all. I'm my first day off after 6 days of hard labor. So I apologize for that, but I am
Yeah,
not
no,
camera ready.
Yeah, thank you, Linda. Thank you for your comment. I know that these are definitely guidelines that are kind of like pie in the sky, very ambitious, and don't always relate to what reality is. With the 3 foot buffer, again, also just wanting to, yeah, be mindful. I mean, trying to warm up and then turning everything off before you go to bed and waking up at 2 a.m. and it's freezing is definitely, you want to prioritize being warm over being, what is deemed safe, which can be challenging. And so I think definitely some of the recommendations I hope are things that might be achievable, such as, wearing a whole bunch of layers when you can, trying to, get yourself off of the ground or putting a buffer between yourself and the ground, just little things like that. But again, knowing that, people, especially in winter, people need to take care of themselves and people do that with any means necessary. So these are recommendations just truly from a safety standpoint, but also acknowledging that there might be times that it is not achievable for a variety of reasons, and just knowing that sometimes these recommendations are a little bit of a barrier. But again, we are able to provide any sort of resources that we can, and anything we can to try to accommodate some of these. But these are just safety recommendations. The 3 foot rule is a big fire marshal recommendation. So it's a big one that a lot of our fire agencies recommend, just out of just being overly cautious.
And then we have another chat question from Destiny Wilder. For those of us that are much further down the line when it comes to housing services and don't cover food services, how can we support winter planning and services?
Yeah, so I will say we focus pretty heavily on the emergency shelter side of things. If we do hear of any sort of like donation needs or anything like that, we usually pass that along again through our email channel or our email communication list. So let's say I'm just going to pick on them because I know that they open overnight in extreme conditions. Sisters Core, if they decide to open and they say, hey, we really need some extra help with food or things like that, could you send out a donation request? Then we'll include that information in our email just to try to guide people to be able to donate. So we do a lot of amplification, but we don't necessarily do any sort of donation management. It's a team of 2 of us, so we unfortunately don't have that capacity, but we definitely try to direct people as those needs are being asked. We try to direct people to those right channels.
I think too, just because I think I know Destiny, kind of what you're asking about. And I think maybe another thing is around that education, right? So those flyers that go out um, frostbite and things like that, I think those would be probably really great information to get out to residents for themselves and their families. I think that's like something that I know the heat stroke one is always one that I'm like, oh man, I do not think about that when I'm feeling those things in the middle of summer. And so I would say the same, even this one, when you were just going over it, Marissa, I was like 40 degrees. I'm out in 40-degree weather all the time in t-shirt thinking like, oh, that's fine. So I think that side of that you all provided would be an amazing thing to share with residents.
I agree.
Yeah, yeah, definitely. And I'm putting the request forms in the chat. So if you aren't part of our listserv and you would like to be part of it for the extreme weather communications, and then also if you are interested in a booklet as well, just feel free to complete those forms. I also will say those booklets are in English and in Spanish as well.
Okay. Are there any more questions or? All right.
John,
Thank you very. Oh,
John,
go ahead,
this is-
Stacy.
Yeah, I had one idea, and I wonder if we can have our intern work on this. We've been gathering some ideas from our unhoused community members about practical things that they've been able to do during the winter months to stay warm. For example, if someone has a tent, we'll get them a larger tent with a smaller tent inside with some Red Cross blankets over the tent. I wonder if we should put together maybe a little resource list of just some quick ideas that we can share. And I can have our intern work with some of our unhoused community members and put that together of practical ideas that are doable in the camps or something.
Yeah,
Okay.
I like the idea. So
Okay, we'll do that and we'll send it out to Rosie or you, and then we'll go from there. And we'll confirm that they're safe ideas before we put them down on paper.
Thank you, Stacey. Yeah, I was just gonna say, send them our way and we can make sure that they get out into on the website and different resources. So thank you.
Awesome. Thank you.
All right. Thanks very much to Marissa and also Carissa. That was all really valuable information. Whether you're working with sheltered or unsheltered people, that can all come in handy. I would also say that if people have questions about what winter weather work looks like, volunteering is a great way to get informed. So there may be folks who don't have jobs that necessarily put them in direct engagement with our population. And volunteering is always a wonderful way to get some of that experience on a basis that meets people's ability to provide their time. So I just want to throw that pitch in there. So waiting patiently, we have Diana Fischetti from United Way of Central Oregon, and she is here to talk about her work and how it affects what we do, and or otherwise just educate us about their work. So go ahead, Diana.
Whenever you're ready, I'll stop sharing so that you can share. Unless we caught her at that one moment when she walked away.
Okay.
Great. Are you all able to see my screen?
Yes.
Oh, wonderful. Okay, awesome. Well, I am Diana Fischetti. I'm the Regional Executive Director at United Way of Central Oregon, and I'm super thankful for the opportunity to share with you today a little bit about our new laundry truck. So thanks to Rosie for the opportunity to chat with everyone today. At United Way, we believe Central Oregon deserves a future where everyone can thrive. So I was with United Way of Central Oregon from 2017 to 2021, and then I rejoined the organization about 2 years ago when we were embarking on a merger with the United Way of the Columbia Willamette in Portland. So that merger is complete, and thanks to the administrative services and resources that we receive from Portland, I've been able to spend some meaningful time connecting with many of you, listening, learning, and identifying where the service gaps are in our region and how United Way can step in to help address them. So my efforts have really been to evolve our agency, which has been in existence for 70 years, so that we aren't just funding programs, but we're also delivering programs directly to our community members. So probably most of you know us as an intermediary funder and grant maker. We will continue to do some of that work moving forward. And we're also launching some direct service programs. The areas are financial stability, food insecurity, health and hygiene, housing, eviction prevention, homelessness, transportation, and disaster resilience. So one of the programs we're launching this year is called CARES, and that stands for Community Access to Resources and Essential Supplies. And this is really our initiative to meet folks where they are. And one of the programs underneath the CARES umbrella will be our laundry truck. So this will be Central Oregon's first and only free mobile laundry service, which will serve folks with both low income and houseless status across Crook, Jefferson, and Deschutes counties. And some of the reasons that we're doing it, we all know that laundromats in Central Oregon are limited. It's $6 to $16 per load. Many folks who are experiencing houselessness or financial instability struggle to afford or even get to those laundry services. And we also know that laundry is a healthcare intervention and a preventative health measure that addresses physical and mental health and hygiene, as well as dignity and well-being. On the health side, it offers infection prevention, disease control, and then on financial stability side, opens up a lot of opportunities for employment, housing, education, and the list goes on. So I know a laundry truck has been discussed by many local and regional organizations and coalitions for a long time as a distinct need, but up until now, we have not had one. So we're super excited that we were funded to purchase and build out our laundry truck by the state through the MAC group. So super, super stoked on that. Before I show you pictures of our laundry truck, I'm going to just tell you a little bit about how they work. So in looking to develop this program and the build out, I met with mobile laundry service providers and laundry truck folks across the nation. There actually aren't very many at all. But there are 2 in Modesto and Tracy in Central Valley, California. There's others in Colorado, Texas, LA. And they are all a little bit different. The physical trucks are all built a little bit differently. They all operate a little bit differently. They do all kind of operate like a shower truck, but there are some distinct differences. The unique thing I think about our laundry truck will be that it is going to be fully self-contained. So it'll be able to visit the camps without needing to hook up to shore, water, power, and sewer at the service site. So that's called boondocking. So it will be able to boondock. We will also have service locations based on, we'll have service locations based on partnerships with other mobile service providers. So we'll hope to deliver services simultaneously. And then we'll also have host locations that do have shore, water, power, and sewer, and hook up to those when appropriate. So the goal is to really amplify existing service provision and dovetail with the mobile service and outreach that folks are already doing. So we plan to have 2 staff per shift to operate the truck on any given service day. We're going to start with 2 to 3 service days a week. Guests will come on a first come first serve basis. They will sign up, they will queue, and then they'll be limited to 1 load per person per day. And loads will be limited to 10 pounds. And that's to keep the water use predictable and the dry time predictable. They'll be given a mesh bag to put their laundry in. The bags will be numbered and attached to the individual guests. The staff will do their washing and drying for them. No clients will be allowed inside the laundry truck. And then guest clothes will be returned to them clean and dry, but not folded. So the United Way Cares laundry truck will have 3 stackable washer and gas dryer units. And you can see I actually pulled pictures of those units off. So these are the actual models that we're using. The washing will use 13 gallons per load on the express wash. And we'll have 1 additional gas dryer because drying usually takes longer than washing. So we chose these models, particularly the stackables, because the folks in Tracy have these exact ones and their board members are like really, really into tracking like how much water they use, what their dry times are. They have spreadsheets, and we had the most data, so we could do all of our water calculations from that information. So we'll have 400-pound propane tanks for the gas dryers. We'll have a generator, a big one, to run all the electric. The hot water heaters will be 2 Instahots. They'll both be electric. And then we'll have 2 heat pumps for temperature control inside the unit. We'll have the ability to plug in, like I said, or boondock. When we're fully self-contained, we'll have 400 gallons of water carrying capacity. So either fresh or gray, not both at the same time. We think we'll be able to do a maximum of 36 loads per service day. So if we do 2 to 3 service days a week, we will hopefully be able to do between 3,750 and 5,600 loads of laundry in our first year of operation. So this is actually not the most current design, but it's kind of the cleanest. So this is a kind of draft layout of the actual truck. I know you can't read it, it's really tiny, but kind of get a sense of what it'll look like. And then this is our actual truck on this slide. So we purchased a box truck, which is also called a step van, in Detroit, Michigan. It is a 28-foot truck with a 21-foot box, and it'll be about 32 feet long in total with the generator mounted on the back. It has a pretty high payload package, but we're also going to be putting in some aftermarket suspension modifications so it can safely carry all that water. Our truck is in the queue to be built out by an outfitter in Texas called Cruising Kitchens. This company does food trucks constantly, like one after the other after the other. They've done 1 mobile laundry truck, and I'll show you that in a second. We are currently 3rd in the queue to get built out, so it's kind of a first come first serve with them. The truck is there, and they're anticipating about a month or two before they can start to work on ours. We anticipate picking it up in early 2026. We've already rented heated storage, thanks to Tim at the Shepherd's House for the tip. So we've got that lined up, and we're actively fundraising for ongoing operations like paying the staff and insurance and storage and such. So although ours is going to look quite a bit different, this is the other laundry truck that Cruising Kitchens built so far. There are 6 photos, so I'll just kind of click through them slowly. This is different because these folks are kind of a boutique service. They go to like wealthy folks' houses and do their laundry for them. But you kind of get a sense of what it looks like. Ours will also have a service window, and then the generator mounted on the back. Our layout inside will be a little bit different, but you kind of get a sense of what it can look like. And then I have a couple videos, and I won't play them now. What I will do is put them in the chat. One of them is about how laundry trucks operate in general. The other is how laundry trucks can be a resource during disasters. So that is my quick little update, and I'm super juiced. I'm happy to answer any questions that anyone might have. And I guess I can stop sharing it. Well, maybe I'll leave it just in case y'all want me to go back to any pictures.
Did anybody have any questions for Diana and our future laundry truck for Central Oregon?
Okay. Well, thank you so much. And I'm sure I'll have more updates when we get the truck, and we'll do an open house and such.
Thank you so much, Diana.
I don't mind asking how long, like, so when will that truck be available, and how long was it in development, and how did you come to put your mind on such a cool idea and realize the difficulty? Like I said in the chat, I mean, like, I wore my jeans so long they wanted to walk away without me in them. And it's hard to find a job that way. So, I mean, like, so how long in development has this been? And can you tell me a little bit about the birth of this idea?
Yeah, it's interesting. It was actually my mother's idea.
No kidding. I'm
but it
so
wasn't-
not surprised.
It was not only my mother's idea, it was also, talking with other folks in the region that know that this is a distinct need. But what kind of got me inquiring about it with folks was my mom having mentioned that that would be a unique service opportunity or option to provide to folks. So I feel like it was probably like over a year ago that I started to look into this and trying to even find laundry trucks in the region or in the country that we could go and check out or talk to. It's been a huge process. And then the MAC group funding came in at the end of June, and we had to spend that money at the end of June. So it was a pretty quick turnaround in terms of purchasing the truck and paying for the build out. And now we're kind of in like a hurry up and wait again. But yeah, I've been very excited, and I think it's really, all the different systems have been really, really fun to learn. Just like freshwater, gray water, the generators, the heat pumps, propane tanks, all that stuff. So there's going to be a lot that goes into running it, and I'm sure there will be things that don't go right at the beginning, but I'm excited.
I just want to say, just like, in case you didn't see the chat, bless your pea picking heart. And you can tell your mom that too. And by the way, if you need staff, I'm sure a couple of homeless people would love to have a job.
Absolutely. Yeah, our goal is to have folks with lived experience be part of the service provision. We're also looking at, in order to supplement our ability to do it from like an operational funding perspective, we're also looking at AmeriCorps positions to potentially help with like what otherwise would maybe be volunteer work. But yeah, that's our hope.
Any other questions for Diana? All right. Thank you, Diana. I think it's a great example of really taking a good look at what the region needs and what type of services are missing in certain parts of our region. And this is great because laundry is so needed and it can make such an impact. And the truck is mobile, so it can go different places where it might be needed, even if you can't tell now where that's going to be. You're going to have the capability to respond to that. So I think that's great. So awesome. Okay, I guess we only have a few minutes left. So if anybody has some important updates, either about new leadership positions, successes that they'd like to share, or upcoming events, especially holiday events, this would be a great time. Before I hand that off, I just want to say, so Shepherd's House is having 2 different Thanksgiving dinners. They are both on the Wednesday before Thanksgiving. The Lighthouse dinner will be from 12 to 3 on that day. And then the one in Redmond will be from 5 to 7 p.m. And the entire community is welcome. There's no parameters to who can attend. So I hope to see many or some of you there. But if anyone else also has some updates, please chime in right now.
John, would you mind sending me that in an email so that I can get it up on our website so that it's up on the website for the events? Thank you.
Yeah, absolutely.
Great. Well, if nobody else has other items to share.
Rosie, can I say something real
Yes,
quick?
yes, please
Yeah.
do.
Hi, I'm Colleen Sinsky of Central Oregon Fuse, and just a really quick update to the community. We've officially completed our rebranding process, and we are switching from being Central Oregon Fuse to the Fuse Housing Collaborative. Still haven't figured out how to change my little Zoom icon, and our website is only half updated so far, so bear with me on this very manual process, but we'll still go by Fuse. Just wanted to keep anyone from getting confused if they see Fuse Housing Collaborative. That reflects what we do a little more accurately. So appreciate working in partnership with everyone and appreciate all the work being done here.
Thank you so much, Colleen. And as soon as you get that new logo, send it over. Oh, no, you did. I will get it updated on the website.
Okay. Well, this being the last meeting of 2025, I just want to thank everybody online here for all the work they've been doing all year that has helped to serve the community that we serve. Hope everybody has a great holiday season. If we don't see you in other contexts, though I'm sure we will, because a lot of us do tend to go to the same meetings and see each other, which is a good thing. Also underscores what I was saying about membership. Yeah, so enjoy the holidays and gear up for January of 2026 when we'll have the pit count and other important work coming up. So it's been great serving with everybody. And I guess that is the end of the meeting.
Thank you, everyone.
Yeah.
And just a reminder, newsletter will be going out in December. So any updates from the HLC will be coming out through the newsletter. Thank you.
Okay, thank you.